Sir, we'll start with Shivani ma'am. Shivani ma'am needs to go. So you can
Sure,
start something.
sure, sir.
Yes.
Sure.
I think we are live, sir. Okay. Good evening, everybody. And this is a important day, like post-exam analysis. And we're really happy for all the FMG students that we had a moderate paper today, unlike the previous exam, which was on the tougher side. And students are happy. There is a mixed feeling, and most of the students have given a concern that usually the paper has been on the moderate side. So we are happy that the paper has been on the expected lines, especially paper one was much easier. We have with us eminent faculties of DocTutorials. They'll be giving you the insights in the relative subjects and also the plan of action for the future aspirants who are listening to us. We'll start with Shivani ma'am. Shivani ma'am, your inputs on the paper and what do you think and what are the topics that were tested this time in the exam in ophthalmology, ma'am?
Yep. Good evening, dear students. Good evening, everyone. How are you, all of you? How do you feel now? So you are done with the exam, isn't it? Excited, all of you? Happy? I think there are mixed feelings. I've got so many messages from students. Very mixed feelings, but definitely. Am I audible?
Yes, ma'am, you're audible, ma'am.
Okay. So mixed feeling to everyone. है ना, ऐसा लग रहा है मैं रोऊं या हंसूं, but करूं क्या? But to the consensus, everybody is feeling happy that we had a moderate kind of paper. And ophthalmology was forgiving this time. They were good questions. I think if somebody asked me my reaction, I would say I'm very happy to see the questions. Most of the questions were from the topics which we have been reading, isn't it? Most of the things have been covered in the live lectures, offline classes. I mean, all the questions what I have got from the recall from my students, I think most of the topics are covered. There is only one question because it is from an instrument that we do not often take in the live sessions, the offline classes. So only one question was there, which was not from the lectures. But definitely all the questions are covered from the DocTutorial app. Okay. So all the surgeries, the instruments I've covered in the app. So I'm sure that somebody who has seen the lectures at our app would be able to solve all the questions. So, sir, this time I've got 15 questions. These are all recall-based questions. So I would like my students to tell me more so that we come up very soon with the proper framework of the questions, all the correct options and the correct answers as well. So I'll be highly appreciating the students if they give us the correct options and the questions. So let us start with it, and it's a very quick, quick session so that we gather all the questions and we talk to the students that they have done well or not. So are you there, guys? Shall we start? So from those 15 questions, the first question supposed to be very, very easy. They have asked you, what is the first line treatment for glaucoma in adults? I think this was the proper framework of the question. And the options given were again easy: PG analogs, atropine, acetazolamide, and pilocarpine. Okay, so if this was the question, the correct answer and a very simple answer should be PG analogs, isn't it? There is only one student, sir, who has told me that the question was not simple. He has told me the word malignant glaucoma is there. I'm not sure, but one student has told me, ma'am, this was the question. So guys, if this is the question, forget about rest of the anti-glaucoma drugs, which is a tricky question. The answer here is atropine. Okay, so malignant glaucoma we don't give the normal PG analogs and all those stuff. We start with atropine, okay? Remember, this could be a tricky question, okay? But we have discussed this in class also. All right, friends. So this may be a question which I'm not sure what exactly was it, okay? Chalo, let's move on to the second one. So the second question says, what is the cause of sudden painful loss of vision in one eye? Okay, it's a very simple question. When you have a loss of vision in one eye, which is also painful, so it should be due to optic neuritis. What comes first to my mind is optic neuritis, that is inflammation of the nerve. So the lesion should be in the optic nerve, isn't it? Optic neuritis, I was expecting one question from this topic and we have got a very, very simple question from that. All right, so this was one of those expected questions, very commonly asked question. Now, this is the only tricky question which I would say. Unfortunately, in such a clinical subject, we expect a lot of image-based question, a lot of problem-based question, but this time they were mostly one-liners questions. And this was only a tricky, tough question. It is on an instrument. So guys, maybe it was a picture of a McPherson's forceps. If this was the picture which had, smooth edges, non-toothed kind of forceps, we call it McPherson's forceps or a IOL holding forceps, okay? Or probably some student was showing me a picture of this one, this instrument. So if you have a curved edge and if you have a toothed forceps, it has tooth also. So it is a limbs forceps. Friends, please remember, there are two forceps which are used in any cataract surgery, apart from other instruments also. If this was the picture, it is a picture of a limbs forceps, which is used to hold the accessory tissues, which is used to hold, it helps us in holding the structures while we are doing the surgery, limbs forceps. And this is the IOL holding forceps, McPherson forceps. I'm not very sure what was it. So guys, do you have any answer questions about this? Can anybody help me with this question? Was this the picture or they were simply asking you limbs forceps?
And all the students we request you to actively engage in the chat box, and you can write down whatever you feel were asked in the respective subjects. So we'll come back with a proper recall as soon as possible, right? You can engage and they can inform us the
Yeah.
required feedback accordingly, right? Yeah,
So
ma'am.
anybody, can you recall, bache, what was the exact picture? Ye tha, ya was it a limbs forceps? There was a picture from a forceps. Yeah, it was a forceps, but was it curved? Okay, JKA was telling that it was something shown here. Is it curved with tooth? So this could be limbs forceps. Somebody is saying McPherson. Second picture. Okay, but please learn for the future, okay? If this is a curved one, it is a limbs forceps. If it is not having tooth, it should be a McPherson forceps, okay? Chalo, let's keep this question again. We'll talk about this later again. Now, this is a very simple question. They simply ask you, shield ulcer is seen in. So we have been discussing this question so many times. The correct answer is VKC, vernal keratoconjunctivitis, and shield ulcer is a kind of ulcer which is usually in the superior half of the cornea. It is because of the irritation by the cobblestone, the large papillae that we see in VKC. It's a very commonly asked question, isn't it? But some of the students got confused with the options probably. Many students mark trachoma here. I don't know why, but we have been discussing this. Sometimes, VKC, when we talk about VKC, children think only about cobblestone papillae, cobblestone papillae. Probably that is one thing that you have missed here. All right, so this was a very simple question. Shield ulcer seen in cases of VKC. Very simple question. Now, one from pharma, one from us. So which anti-TB drug causes red color vision defects? Or some of the students are saying that this was not something about red color vision, but simply they asked us which anti-tubercular drug cause optic neuritis. So again, I need your help, bache. Was there a question on optic neuritis or red color? For both, the answer should be what? For both, the answer should be ethambutol, isn't it? Very frequently asked question again. We know the answer here is ethambutol, but I just want to confirm whether they were asking you about the color vision defects. Ethambutol also causes the color vision defects, red-green color blindness, isn't it? So optic neuritis is also very known feature. Color vision defects, green color vision defects is also a known feature. For both, the correct answer is ethambutol. So something like diminished vision only. Okay, let us consider that they ask us red color nahi likha tha. Okay. So it is about decreased in vision, not about the color vision defect. Okay. Was there any other question which was mentioning that there is a problem with red color vision? Because I got two questions. No, optic neuritis wala question was different. है ना? Optic neuritis was different. Origin. Okay, there was no question which has mentioned about red color vision defect. Is it? Optic neuritis पे दो question है. I understood. One we have just discussed that there is a loss of vision with pain in the eye, isn't it? Loss. Here was the question. Please see. Loss of vision with pain, isn't it? So this was about optic neuritis only. Okay, one of the option here is pyrazinamide. All right, I'll change it. Okay, this was about pyrazinamide. Okay, thank you. Thank you, Dr. Vignesh, that you are helping me with the options. Thank you. All right. हाँ ना red color वाला एक. I think there was one question which was mentioning about red color. Kindly frame the question for us, guys. If there was a question on red color defect, probably again ethambutol is the answer here. Chalo. Now, this question, they were asking you about which bones are cut or removed during external DCR. So guys, again, a simple question. If you are familiar with the anatomy here, anatomy of the lacrimal drainage passage, you must be knowing that the sac is in between your maxillary and the lacrimal bone. So these are the bones which we cut, isn't it? So as you know that DCR surgery is done for chronic dacryocystitis, that we make a new opening at the level of middle meatus. You should be familiar with the anatomy also. So we have discussed this question also during the lectures, isn't it? Chalo, ठीक है बच्चे. Next question, very, very easy. Very frequently asked question, repeatedly asked question. We know that rosette-shaped cataract is seen in cases of blunt trauma. So lacrimal and ethmoid. Lacrimal and ethmoid. Okay. This was in combination. Okay, okay. Or अच्छा red colored triage में था. I'm so sorry. All right. Probably we missed. All right, all right. Understood. Red color was there for the triage wala question. Understood. Okay. So rosette-shaped cataract, guys, trauma we expect, morphological cataracts we were expecting. So this is one question. Image was not there. They asked you very simple question that rosette-shaped cataract is seen. It was in blunt trauma. Everybody knew it. Most of the students have marked this correct. Now let us talk about this question. You're mentioning CME wala question. So CME wala question ye hai bache. I think this was the framework of the question. They've given you a problem-based question that there's an old man who has undergone a cataract surgery and he comes to you with a decreased vision. And he is a diabetic also. And when once you saw the retina, you found a honeycomb appearance. So there are some keywords, isn't it? Cataract surgery hai, diabetic hai, honeycomb appearance of the retina. I think it's a very straightforward question. You know the honeycomb appearance, very common. Honeycomb appearance is seen in cystoid macular edema, isn't it? So ye bhi bada simple question tha, but they have given you these three clues. I think everybody marked this correct. CME. है ना? Honeycomb appearance of the retina. So many times they have asked you. So some question from optic nerve glioma. Again, I've taken this. I think this was one of the questions, bache. Is it? Ye tha, optic nerve glioma is seen in NF1. I think that is very simple question. Is it? Was this the language of the question? Simple one-liner. Flower petal word was also mentioned. Acha, both the words were mentioned. Flower petal appearance word is also mentioned. Okay, okay. Now, very easy, isn't it? If they have mentioned both the things, that there was a flower petal appearance and honeycomb appearance, then the question becomes easier, simpler for you. Okay? Chalo, this was the question, one of the questions, beta, optic nerve glioma is seen in. If this has been the question, very straight, simple question, very simple answer, isn't it? Optic nerve glioma is in the option ulta tha. Okay, okay. What do you see in the eye? What do you see? Oh, ulta tha. Okay. What do you see new in NF1? All right. Okay. Okay. Thank you very much. Okay. NF1 is AD or AR. Which of they were asking you about autosomal dominant and autosomal recessive also. Is it? Okay. Okay. But I hope you understood that they wanted to ask you that what do you see in eye in neurofibromatosis type 1? Is it? And the right option was the question. Understood. Got it. The question was other way around. All right, all right. Thank you, everyone. Thank you. But I'm sure that everybody marked this correct, isn't it? Yes, everyone. Simple question. Chalo. Now, again, very, very simple. Most of the time, every exam, they're asking you what are the causes of blindness, percentage, most common children, है ना? So again, a very simple question, vitamin A deficiency, very straightforward, isn't it? ठीक है, vitamin A deficiency we have been discussing so many times. We have discussed blindness in children is vitamin A, blindness overall is cataract. क्या है? ऑप्शन इज वेरी डिफिकल्ट. क्वाड्रेंट, ऑल क्वाड्रेंट. Okay. Which question are you telling, beta? Options is very difficult in one question, one quadrant. If you get to know the question, kindly DM me, please. If you get to know the question. Chalo. Now, this was the question which somebody mentioned that there was again a case-based scenario where they have asked you a child who is 1 year of age probably, or maybe the age is different. Somebody is saying 1.5, 1 year old child who has come to you with a white pupillary reflex. So guys, all of us know that white pupillary reflex is leukocoria, isn't it? And there is a history of eye removal surgery in his father in his early childhood. Okay, so there is a history of enucleation or evisceration. They haven't mentioned the name of the surgery, but there is a history of eye removal in his father. So, can I take this as retinoblastoma? Isn't it a very simple question? Because we also know that retinoblastoma comes to a child when he is mostly 1.5 years of age. The most common presentation being leukocoria, and you know there is a chance of familial inheritance also. So if the child's father also had retinoblastoma, there might be a massive retinoblastoma. For that, he has undergone a enucleation, isn't it? So again, a very simple question. Okay. So leukocoria, the age of the child, and a history of enucleation in the parents. All right. D was coloboma. Okay, okay, good. Thank you. Why I'm saying good, bache? Because coloboma is one of the causes of leukocoria in children, isn't it? Please remember, a massive coloboma, huge coloboma in the retina is one of the causes of leukocoria in children. But for coloboma, we don't expect a history of eye removal in the father. And age, 1.5 years pe leukocoria kyun? If there is a coloboma, there will be a leukocoria since the birth. All right. Acha, so I'm coming to that question in a short while. Somebody telling me about NPDR. I have got a question from NPDR. Guys, please be a little patient, but thank you very much that you are telling me the questions. Dr. Sophia, Dr. Gayatri. Okay, just give me a few more minutes. I'll come to that question. Let's talk about this question. Only one student has given me such a question, but the language I couldn't formulate. So you have to help me again with this question. So one student told me that there is a question about a 3-year-old girl who came to the OPD and she is having a squint also. And he mentioned that something was there in the retinoscopy as +9. Is it? Is this the question? And he mentioned that atropine was given somewhere. Only one student told me that something was there like +9 ka sphere hai retinoscopy mein, something like that. Language was very difficult. No question. He also told me the same, that something was mentioned he couldn't remember at all. Something was orthophoria or okay. Maybe, but something was there regarding squint or orthophoria. If you get to know this question, Bache, please let me know again. Now, it was +1. See here again, one student is telling me that there is one question on retinoscopy, maybe +1. Maximum recall questions are not so wrong, bache. No. Chalo, maybe this is one of the questions. So new vessels in retina is seen in non-proliferative diabetic retinopathy or proliferative diabetic retinopathy. Was this? This is the question where you are telling me about the quadrants. So can anybody form the proper question? Pailu Karkin is there. Okay, there was one question where they were asking you how to differentiate between a non-proliferative and a proliferative diabetic retinopathy. And the only differentiating feature is about the new vessels. So if you see new vessels in retina, it is a case of proliferative diabetic retinopathy. All right? हाँ, इतना easy होता तो बात ही क्या थी. But what was the question? You have to help me with that. Dr. Sophia, we have discussed that question as the first question. You can go back to the PPT, you can see. All right, which was not seen in NPDR. So again, no, NPDR में क्या नहीं दिखता? You don't see new vessels. Hmm? Chalo, one question number 14 is something about the muscles. Which muscle is uh, inserted closest to the limbus? Probably a figure was there. Some students are telling me that figure was not there. So if this was the question about spiral of Tillot's or the muscle which is closest to the limbus, medial rectus should be the answer here. Medial rectus is the muscle which is attached closely to the limbus. Okay, closely to the limbus. No word of new vascularization. We'll come back to this question in a short while. So this is the last question which I've got from students, that there is a child who's having a malnourishment and there is a corneal xerosis also. Probably the word cornea is not there, only the word xerosis is there. So xerosis means dry eye. So if you have dryness of the eye, the child is malnourished. Which vitamin is deficient? I'm sure everybody know that we are talking about xerophthalmia. So the correct answer was vitamin A. Okay. So this is a very simple question. चलो अभी ये वापस पढ़ते हैं. So figure was there to arrange in order. Okay, okay. Arrange in order again. So Mills is the mnemonic here. Mills. What is Mills? That medial rectus is closest to the limbus, then comes inferior rectus, then is lateral rectus, then superior rectus. So can I say that superior rectus is farthest from the limbus? Okay, this is the order. All right, very good. ठीक है बच्चे. So this question is done. Xerosis and keratosis word be there. Acha, keratosis bhi hai. Okay, thank you. So again, the answer is same. Answer is vitamin A only. Keratitis bhi tha. Keratosis. All right, I'll come back to this question. Can anybody help me with this question? Anyone? They were asking us how to differentiate between a NPDR and PDR. All right, maybe this was a tough question. The language, basically, they wanted to ask us how to differentiate, but probably the language was little tough. That's why you're not able to recall. Probably maybe in a day or two, I'll get the question and then I'll come back with this question again. But I hope you all know the answer should be something related to new vessels only. So if we see new vessels, it's a case of PDR. है ना? Even if you have a severe NPDR, Dr. Gayatri, if you even have a severe NPDR, you don't see new vessels. Okay? Forget about the quadrants. Even if you have not NPDR. It's okay, bache, theek hai. It's okay, absolutely fine. But I hope that you know how to differentiate it. I'll come back to the question. It was a complex question. I get that. It was a difficult question. The language was different and difficult. That's why it is creating a little problem. But the answer was something about new vessels. And if they are asking about new vessels, forget about the number of quadrants. Even if it is there in one quadrant, it will account to be a proliferative. ठीक है? Beaded vein भी था. One quadrant, four quadrant. See, again, I'm telling you, whatever finding is there, except new vascularization, it has to be NPDR. Even if the word beading, even if the word IRMA, anything is there, it has to be a NPDR unless until they mention new vessels. Okay, forget about the beaded word. Na, so beaded is NPDR. Proliferative means new vessels. All right, everyone. ठीक है, beaded word था ना, it's okay. Beaded means NPDR. It's a very severe NPDR. Okay. Chalo guys, I hope ophthalmology was good and you had a very, very good exam. You will sleep well tonight. So Dr. Khalil sir, so I have discussed all my questions. I would like you to the session. Thank you very much. Good luck, guys.
Thank you so much, ma'am. Thank you so much.
Relax and sleep well. Take care.
Yeah. Thank you so much, ma'am. And after ophthalmology, I think most of the questions were doable and very few new questions were also there. And we'll move on to the next subject of ENT. Also, very, very expected questions in ENT, and a lot of students were happy with the ENT questions. Rajiv sir, warm welcome. And what is your first insights into the paper of this time? And
yes, thank you very much, sir, and good evening, everyone. And the paper is moderate this time. I will not say very easy, but it was moderate paper. Particularly, paper one was towards the like lighter side, but yes, paper two had like its own challenges. But overall paper 1, paper 2 feeling, whatever I could understand from the students was moderate. And ENT was, I think, doable as students have messaged. We'll collect more information, sir, in the next 1 or 2 days, and we will publish the question in the proper format and try to recall as many choices as possible. And you can directly message me also on the Instagram or Telegram where you are. My reason of coming. I was actually traveling, but I thought I should come to. But may I remind all of you that you guys have done well. You've done a lot of hard work, and you deserve few days of leisure right now, and pleasure also. I do understand there's huge pressure to know what was the question, what was the answer, and all faculties are trying their level best to bring that for you. But I would suggest all of you to please spend some time with family and friends, and go out and chill out a bit. And you need to unwind yourself, because it's a very taxing thing. Exam like FMG, which is having so much value, we do understand that you would be under tremendous pressure. So as you are helping all the faculties, to recall the questions, please make a plan for next couple of days to have some moments of ease, particularly with your family and friends now. And regarding ENT, I would not bug you because I know a lot of faculties are waiting. Please just message me on the Instagram or Telegram, wherever you are. I could understand the topics were atrophic rhinitis to angiofibroma, and then to laryngeal carcinoma, to tracheostomy, and many topics which are discussed at length in the app of DocTutorials were there. So initial impression is that we could add some value to your preparation, but do let us know. We'll be eager to know. But at the same time, do relax. Dr. Khalil, I will not take much time, and I would like to invite the next faculty for the further communication, sir. But I will request everyone to please message me on directly wherever you are, Instagram or in any group you are, or in Telegram, about the question and choices also, so that we are able to frame up and then present to you the material of the recall. Thank you very much. And we all have only one prayer, that we all wish that may you all pass the exam. You have worked hard and you deserve to pass. That's the actual feeling of all of us at this moment for all of you. Thank you very much, everyone.
Thank you so much, sir. And sir is joining with a busy schedule, and really appreciate that thing, sir. Thank you so much. And Rahul Rajiv, sir, medicine has been a major subject, even in this exam, lot of questions. What is your insight, sir? Different systems that were tested, and how is the question pattern this year in medicine?
Yeah. So thanks a lot, sir. And just before I begin, the one sir had said that, you can message him the topics. I should say that, in case you're planning to take a break and travel, the one sir is someone who travels across the globe. So if you want to have a good idea about tourist destinations, you can just ask sir as well. So that can also be messaged. Now, coming to medicine, dear students, my initial insights are that it was an uneven distribution. If you take different systems of medicine, I felt that cardiology and neurology had more representation from the recalls that I got so far. And in this session, I'm not going to do a detailed recall. I'll be doing a separate recall. I'm just going to focus on the topics that were asked in the exam this time. So just let's brush through the topics asked from the various systems. If you look at cardiology, like all the topics were expected, high-yielding topics, and we have stressed this in the DocTutorials lectures as well. Let's quickly go through them. Arrhythmias, ESVT treatment, and ventricular tachycardia treatment, both of them expected. An ECG on inferior wall MI, I suppose there was a question. They asked about the treatment of inferior wall MI. And amiodarone, always expected. They asked about side effects. They asked all our side effects except an important question on blood sampling in infective endocarditis. Remember, a similar question was asked recently in the INICT as well on blood sampling in infective endocarditis. A simple question on rheumatic fever treatment, one question on gestational hypertension treatment, and JVP Wala question was there. I think they gave a clinical scenario of Beck's triad and JVP showing absent Wiedison. So if you look all these questions from expected areas, quickly moving on to neurology, headache, simple question on migraine, simple clinical scenario, a question on SDH, again expected, Broca's aphasia, simple question. There was a question on an extrapyramidal syndrome, and I think there was an image on Lewy body. That is what I got from the students. So dementia with Lewy bodies was asked. A slightly tricky question this time on seizure risk following a penetrating head trauma. That was a factual question that was asked. A question on asterixis, and also a simple straightforward Wala question on hemibalismus and site of lesion that we used to discuss in class as well. Then endocrinology, you had a question on Cushing syndrome. Then a question on high-dose dexamethasone suppression test. What I always say is that if you give a high-dose dexamethasone suppression test, and if ACTH is not suppressed, you should think of ectopic ACTH. So that was asked. An expected question area is multiple endocrine neoplasia. Question was asked. Question based on diabetes HbA1c was asked. Pulmonology, as always, you can expect question based on pulmonary function test. I always stress in my lectures as well, you will be given a clinical scenario and they'll be giving you a PFT value. They will either give you obstructive or restrictive lung disease. From what I understand, the question had a scenario of a wheezing with an obstructive pattern. Reduced FEV1 percentage was given, so likely to be bronchial asthma. Then a question on pulmonary embolism, again, scenario of a DVT, sudden onset breathlessness, and I suppose they had given the ECG finding as well of sinus tachy with a right bundle branch block. An X-ray of cannonball metastasis was given. Then a few questions I got from the students, was some students message there was an X-ray on pneumothorax. I did not get the exact question, so I'm not sure about that. Then these were the major areas from which questions came. A few surprises. Hardly any questions from nephrology from what I could get so far. We are just a few hours after the exam. So, but whatever I've got, I've not got any question from nephrology so far. Rheumatology also, I have not got, except for that rheumatic fever wala question. But again, that can be grouped under rheumatology. I mean, cardiology, but otherwise I could not get question from the rheumatology as well. But somebody told me there was a question on reactive arthritis, and just before the session began, I was just telling Khalil sir as well, every FMG exam, one medicine and orthopedics and radiology question we share is ankylosing spondylitis, but that shared question has not come in. We are a bit sad about it because I know everyone would have prepared for that question. So this is it, overall distribution of medicine questions. The questions that came were from expected topics. That's number one. Number two, slightly uneven distribution of weightage. Number three, not much image-based questions, except for the ECGs. Overall paper also, I think the images were relatively less. And then whoever has done the class notes well, as revised, they would have been able to write. Were there a few surprises? Yes, maybe the question on penetrating head trauma and the seizure risk. Those were the only questions which came as surprises, but otherwise, all from expected topics. And I think there was a question on cartilaginous syndrome as well. So just a quick recap of the medicine topics. And to all the students, see, you might be listening to different recall-based session. Do not worry, do not panic if you have got a few questions here and there wrong. Mind you, see, when we faculties get questions also, some of them may be incomplete recalls. So only if we get a solid, concrete recall, we'll be able to see the exact answer, which is why we are not doing a detailed recall now itself, because there are chances that, we might also commit errors on hearing a partial question. So don't worry. So this is just to familiarize you with all these topics, and I'll hand over to the other faculties to carry on the discussion forward. Do stay tuned to the DocTutorials YouTube channel. We'll be doing more recall videos, so you can just subscribe to the channel, and you can stay tuned for the detailed recall videos as well. Thank you so much, everyone.
Thank you so much, sir. And we have with us our ortho faculty, Dr. Rohit Daniel, sir. And sir, what were the questions in orthopedics this time, and how was it this year, sir?
Thank you, sir. So good evening to all my dearest friends. So a teacher is happy when the students are happy. I think this time our students are relatively happy. When you think about what happened last FMG exam, this time is much better, and our students are much more hopeful and happy this time. Especially after the first paper, people were really happy. But after the second paper, the happiness has come down a little bit. But even then, we are all very optimistic. We are very sure that definitely this time the pass percentage is going to go up. And I think even in the second paper, what I gather is that even though the questions were a little tricky, the topics from which the questions came were all along expected lines. Probably this time, instead of one-liners, there were more questions based on clinical vignettes. And even in the clinical vignettes, rather than asking for the diagnosis, they were asking for the first line of management and things like that. Probably that is what made the second paper a little bit tricky. As far as orthopedics is concerned, every year orthopedics is a lifesaver for students. This time is also no different. We had 809 questions and all of them were relatively easy. As far as I know, we had a question from osteoid osteoma. This time they had not asked an X-ray. This time they had shown a pathology picture. So it is an overlap between pathology and orthopedics. But the key factor there, that is a pain on the thigh which subsides with aspirin. That itself is diagnostic of osteoid osteoma. So that is one question. We had a question on scurvy affecting the bone. The question was, where do you see pencil thin cortex? That is in scurvy. Then again, as Dr. Rahul Rajiv sir said, I also heard that there is a question on Reiter syndrome. I'm not sure how the wording was. I think the question was what HLA is seen in Reiter syndrome or something like that. That was one question. Then there was a question on anterior dislocation of hip. Again, all my classes, I take this, how to differentiate between anterior and posterior dislocation. I think all of you have got this correct. The deformity is flexion, abduction, external rotation. That itself is diagnostic of anterior dislocation of hip, anterior dislocation of hip. Then another question was on gunstock deformity. Again, an image I think was given. It is cubitus varus seen in malunion of supracondylar fracture. Again, a very important question. Another question was on terrible triad of the elbow. So it is a triad of three things. One is a elbow dislocation along with radial head and coronoid process fracture. So there were four options. The question was, which is not seen in the triad of the elbow. The option that is not seen is your fracture of the olecranon. I think the same question was discussed in one of the FMGE classes that I took. So again, on expected lines, one tricky question that I think has come that has created confusion among the students is injury to an 8-year-old child, and an X-ray of the elbow was given. And I am not sure whether it is a medial condyle or a lateral condyle fracture. Anyway, it's one of those. Both medial and lateral condyle fracture X-rays are usually not asked for the entrance examinations. So I'm not sure what X-ray that is. Anyway, that is the only one I think is a little bit of confusion that here. Otherwise, all the other questions were straightforward. So I think you can score at least 90% of marks in orthopedics. So one thing I just want to tell you is that over the last few months, I know how much effort you have all put in. So people from outside may not know the amount of effort that a FMG graduate has to come into India to get acclimatized to the system that is taking place here, to get to get adjusted to the various examination systems that is going on here. So the hard work that you have put in has to be appreciated, irrespective of what the outcome is. So irrespective of what happens on the result day, congratulate yourself that you have done an excellent job. So please never lose your morale and please be happy, and you deserve a rest for a few days. So please go home, enjoy your life for a few weeks till the exam results are out. Be happy, that's all. All the best.
Thank you so much, sir. And thank you so much for the insights in orthopedics also. And we have with us Dr. Sandeep Sharma, sir, our pediatrics faculty. Sir has been very active this session with the complete FMG discussions, the rapid revisions of pediatrics that sir has been done, and the classes throughout has been very well appreciated also. Sandeep sir, your inputs on the exam, especially for the pediatrics part, and a lot of question on milestones also, and neonatal resuscitation also. Your input, sir.
Thank you so much, sir. So a very good evening to all the faculty members and all the students who are attending in this session. I will not take much time. See, I don't have the exact recall right now. The detailed recall I will be doing later. First of all, some generalizations which I heard. Number one, it was a moderate to tough paper. Paper A was easy, as told by most of the students, relatively easy, I would say. Not exactly easy, but relatively easy. Paper B was found to be slightly tougher compared to paper B. Secondly, the common opinion, the majority opinion which I've heard from some of the students is that there was no demarcation of the paper as such. There were clinical questions in paper A and clinical and one-liner and pre and para based questions in paper B also. And regarding my subject, that is pediatrics, there were about 3 to 4 questions in paper A also, and some questions were there in paper B also. So I will just be summarizing the topics here, which I've got. I'll not go into the details. Detailed recall, as I said, I repeat, we will do quite soon on the DocTutorials channel. So there was one question on neonate with rash appearing on second day and going on day 4. If you have attended the DocTutorials lectures, or if you have attended the TND which I took, you would notice that I had told you there are 5 differential diagnoses, and one of them was erythema toxicum, which was there in the option. So it was a tough question from FMG perspective. It is something we do not expect in a FMG exam. But again, as I said, the questions are becoming more clinical, and that is why all the future aspirants who are listening to this discussion, the days of one-liners are over. Even the one-liners which are asked, they are also not direct one-liners. They are they are components of the clinical case scenario based things. So you need to adapt yourself and just not, go into the cramifying 2000 one-liners and thinking that you will crack the exam. This is not going to happen. For those who have given the exam, rest assured that job has been done. There were easy questions also. So there was a visual on pellagra. There was a 2 cases on vitamin A deficiency. One was leaning more towards ophthalmology. One was a malnutrition case, which had dryness of the cornea. So xerosis was there. So that was a vitamin A deficiency. It was a very easy thing. And xerosis means dryness. Dryness in a malnourished child is vitamin A deficiency. A line ki form mein we have written already in all the offline classes as well as on DocTutorials lecture. So there was a cystic fibrosis question. And yes, there were at least 2 milestone questions. Milestone जब नहीं आता है तो नहीं आता है, and when it always comes in a pack. That is what I always say. And if you have not prepared milestone, it has a tendency to be asked in the exam. Having said that, the questions which were there, they were interesting, they were tough, but they were solvable because they were from the expected things which were asked. One was the question on which is the earliest to appear, transferring hand to hand, laughing loudly, feet to mouth. This is one version. Some students said, no, sir, they are directly asked transferring object hand to hand. 6 to 7 months is the answer. This is something we have discussed in the class. And milestone number 2 was related to immature grasp and stranger anxiety being there. So again, these are expected milestone questions. You don't need to read exotic things. If you know that milestone is important, you revise it 2-3 times, and you do only limited number of them, as I keep saying, you would have done well in both the questions. So when I say solvable, it doesn't mean that it is an easy question. Solvable means it's from an expected topic and you are supposed to, it's a competitive exam, you're supposed to remember those facts. If you forget them, somebody else will be remembering it, right? So that is what we mean by solvable. Then there was a tough question. It was a very tough question on neonatal resuscitation. When would you give epinephrine after chest compression and PPV has been done? Time limits, again, there were options related to 30, 60, 90, 120. What would be the answer will depend upon what they have asked. If you are taking the total time duration, it will be 90 seconds. If the question is saying after how much time of positive pressure ventilation alone should be done, it would be 30 seconds. And if they say PPV with chest compression, it will be 60 seconds. So that is why recall may you have to be careful, and you need to tell me in the comment section ki sir exactly kya tha. If they had mentioned chest compression and PPV has been done, the answer will be 60 seconds, right? It's a INICET level question, but again, not every question needs to be solved, right? So there will always be tough questions. And there were a clinical question on Turner syndrome karyotype, very easy question. Webbed neck was there, 16-year-old girl, short stature, to galat nahi hona chahiye. There were 2 questions, one direct, one indirect on Down syndrome. Tradition continues. no exam of FMG is over without Down syndrome. So there were two questions. And there was also paper A had a question on surfactant deficiency related to HMD. And apart from that, there was a CSF analysis, meningitis, always asked. So normal glucose was there along with race cell, race protein. So it will be aseptic or viral meningitis. Again, an indirect repeat question. And there was a question where they had said, clinical case was there and it was some dehydration and which category it will come. So if you have no dehydration, that is green. If there is some dehydration, it is yellow. If there is severe dehydration, it is red. And there is no blue category here. So it was a IMNCI guidelines based question. More questions, more recalls, they will be coming and we will be doing the recall later. Right now, job is done. Please take time out for yourself. As Rajiv Dhawan sir also said, take out time for yourself. Have a good meal. Watch some Netflix series, the things that you missed out on. De-stress yourself. Most of you did not have a haircut or did not shave yourself. Go get it done tomorrow and then attend the recall sessions once they happen. So don't go away. Stay tuned for DocTutorials channel. And afterwards, more faculty members will be sharing their opinion. Sir, that's all from my side. Thank you so much, sir.
Thank you. Thank you so much, sir. Thank you so much. Next, we have our physiology faculty, Dr. Naveen Powal, sir. Good evening, sir. And a lot of students have been telling that physiology has been integrated with medicine and pharma, and they really appreciate your sessions on that. Please, your inputs on the physiology.
Yeah. Good evening, sir. Good evening, everyone. So, as almost every question has been discussed by Dr. Rajiv sir and Dr. Sandeep sir, because this time physiology is totally integrated with pharma, pediatrics, and medicine. And we have discussed that. For example, there was a question on the COPD. So, FEV1 was less. They were told that FEV1 is less. If ratio is less, that can be COPD. But if ratio is more, but FEV1 is less, it can be RLD. So, complete recall cannot be set. It is all depends on the ratio. Then, second question was regarding the surfactant. As Sandeep sir has told, surfactant less, it was, of course, hyaline membrane disease. Then there was a question that some patient is taking loop diuretic and is having hypokalemia. So, which diuretic you will add on? For example, there can be amiloride. So what I got the recall is regarding the amiloride was the option there. It is a ENaC blocker. So amiloride was the option. Then there was a question that we have discussed so many times that almost every year they ask so many questions on glucose transport. Even if you see the insight on the FMG paper we have discussed, I have told that there are always 2-3 questions only on glucose transport. For example, this time they have asked GLUT4 about that which is the only glut that is insulin dependent, and answer was GLUT4. Then one question was about the SGLT. Which drug is SGLT blocker? It was canagliflozin. So 2-3 questions are always from glucose transport. So what I've seen that if we command few topics and that are integrated with your pharma and medicine, we can solve more than 15 or 20 questions directly. Okay. Then there was one question that was regarding the heart block. Some students are telling it was MOBIS1 or some are saying it was Van-Quebec phenomena. I'm not clear about that. Then one thing is that we know that when ACTH is high, it causes hyperpigmentation. So that was the clinical scenario. It can be Nelson syndrome, it can be Cushing disease, or it can be Addison disease. The main thing was that ACTH was high and that was causing the hyperpigmentation. And some students were telling me that was small cell carcinoma. It was a lung cancer, and that is why there was this increased ACTH level. And when extracranial ACTH was high, of course, there will be hyperpigmentation. So I have seen that for last 5 years, one question is always from the hyperpigmentation due to excess of the ACTH. Then some student told me that there was the irregularity of the concentration of different ion. It is maintained by or generated by. If question was it is generated by, then answer will be cell membrane itself. This was the option. And if question was it is maintained by, then answer will be sodium potassium pump. So it all depends on the stem of the question. I'm not very much sure. I will be coming with all the recall within 2 days. I will try to. So these are the question. Then there was a question on the recurrent. This sinusitis was there, bronchiectasis was there, and dextrocardia was there, and they asked the diagnosis, and most probably it was carcinoid syndrome. The slide was given. So one question was regarding the carcinoid syndrome. Then there was the extrapyramidal tract question was there. There was a clinical question, and they asked which tract is damaged, and answer was extrapyramidal tract. So I think these are. Then there was a question regarding the hemibelesmus. They asked there was a flailing limb abnormality. What is this called as? And I think the answer might be hemibelesmus. So these are the recall which I get till date. I'll be coming with all the recall with full options within 2 or 3 days. Thank you. Thank you, sir.
Thank you. Thank you so much, sir. And moving on to the next subject, we had, dermatology also, a lot of questions on leprosy and other topics. And we have with us Dr. Pallavi ma'am. A warm good evening, ma'am, and your inputs on dermatology for this year, ma'am. and overall how the exam was there in this year. You are on mute, ma'am. If you can unmute and speak.
Hello, sir.
Yeah.
A lot of dermatology questions this time, around 10 of them, though I have broadly collected the recall topics, but the exact questions with the images are yet to come. But one thing that I can say very nicely, sir, Dr. Khalil, as we discussed on 18 January also, 100% strike rate from dermatology. All the questions have been discussed not just in the regular lectures, but also in the rapid revision and the image sprint. Not a single question out of what we have studied. So I just hope that I'm able to add 10 marks to your exam, and that be it. I hope all the students who are seeing this video tell me that they have got all derma questions correct. No difficult question till now, often repeated. Let me just share the screen. I'm doing this from the phone. Just a minute. I've just so, sir, is my screen visible?
No, yeah, ma'am. That's visible.
Okay, so that is the dermatology. First question that I got was that of psoriasis. This was an image of psoriasis, and the treatment was asked, the treatment for which is topical steroids. Then, sir, is the audio and the video matching?
Nice. Yeah, ma'am. It's perfect. Ma'am.
Okay. The second question was from STDs, which was the vaginal warts image. It has been asked every alternate exam for the last 4 years. So this was a super important image as told to all the students, and it has been asked even in this exam. Then LGV, though as a question, LGV has been asked for the first time in the last 5 years, but we've discussed it every time, and being a part of STDs, which was amongst the most important topics from derma. Again, this was an expected question. I hope they all got it correct. Then the Amsel's criteria from bacterial vaginosis. Again, this question is being asked in NEET PG for the last 4 years. And even in the FMG exam, it is asked almost every alternate exam. So this was also a very expected question. It has been asked. Leprosy was a question asked in the previous exam. And now in this exam also, they asked a question on enlargement of ulnar nerves with lesions on the body. What is the diagnosis? The diagnosis was lepromatous leprosy. Then again, malignancies have been a very favorite in this exam. For the last 10 exams, every year, at least 2 to 3 questions on skin malignancies. And it was the case this year also. A question on rodent ulcer of BCC. Actually, sir, I've seen, I tell this to students also, that they are revisiting questions from the past also. Initially, it was just those questions were asked as one-liners. Now they put an image. They will, ask like Marjolins ulcer in the previous exam, rodent ulcer in these exams. These are very favorite 2015 to 20 in the FMG exam. And now they are coming back asking the same topic, but in a slightly clinical scenario. So, my dear students, if you are solving the questions, don't just focus on the last 2-3 years. Go back to 10-year questions and revise all of them, because you never know what they are going to ask. Even though they look for new questions, but all of them are important. Then the histopath of molluscum has been asked. Again, expected question from pathology as well as dermatology. I always show them the image and tell them that this is what you have to look for in the image. And this is pellagra, as expected. It was asked. Then child with cirrhosis and night blindness, vitamin A deficiency. Shivani ma'am discussed it. Dr. Sandeep discussed it. So deficiency syndromes, STDs, and psoriasis. These were 3 topics which I had highlighted over the last 1 month or so for all the students. And this has been asked in this exam as well. So from my side, I will say that I hope you got all the derma questions correct.
Yeah. Thank you so much, ma'am.
And yes.
Yeah.
And please, dear students, if you have any recall options, questions that you wish to share, please put them in the comment section. We'll be coming out with a proper recall video by tomorrow or day after.
We request all the students also to assist with the proper questions and options for individual subjects. Okay, we can reach out to the DocTutorials team or to the individual faculties and share of the questions and the images with the option that will help us make a proper recall. And we have with us now Dr. Vandana Puri ma'am, our eminent pathology faculty, and a warm welcome and a warm good evening, ma'am. And what are your insights into the paper? How has pathology been for the students and overall the paper this year, ma'am?
So hi bacha log, how are you all? I am sure everything is over. Exam is over. So fun time now, chill time, right? And what can be better, than finishing the exam so well? The paper this time was better than the last time. And of course, the questions were much, much better and doable. एक दो बाउंसर्स तो हमेशा ही आते हैं, तो वो तो उसके लिए तो रेडी रहना ही होता है, बट अदरवाइज इट वाज क्वाइट डूएबल पेपर एंड आई थिंक मोस्ट ऑफ द थिंग्स वर डिस्कस्ड इन द ऐप एंड इवन द टफ क्वेश्चंस वर डिस्कस्ड इन द ऐप. बट आई शुड से सर कि गलत बात है, एफएमजी वालों को ये क्वेश्चन नहीं पूछना चाहिए था, तो जो 2-3 मॉलिक्यूलर क्वेश्चंस पूछे, so they were really tough. And plus there was a recall question which was asked in INICT this time, infective endocarditis cultures kaise lene hain. That was an INICT question which was asked to the FMG question, exam question. This is not justice, this is not correct, but okay, this is like a bouncer. But otherwise most of the paper was good. So just one slide I'll share. Okay, so basically these are the set of questions. Majority of the questions were doable, and the tougher ones I'll just tell. The steps of repair. This was a little tricky one because they had not given the classical, they had given you the steps, hemostasis, inflammation. So remember a code always. सबसे पहले platelet plug बनता है, तो हमेशा hemostasis होता है और last में remodeling होती है. So जिसमें भी hemostasis first था, remodeling correct option था. So that was the simple one. Okay, the second was osteoid osteoma. It was integrated with the ortho, and as Rohit sir said, that history was very suggestive. It responded to aspirin, and I was very surprised after the first paper. Somebody messaged me, "Ma'am, ये question आया था," and I was like, "My God, go ahead, focus on paper 2, come on." And then this was a great top vacutainer. Vacutainer is always there. ठीक है, तो ये मेरा jinx question था. I added this before the exam also.
I remember, ma'am, before exam.
Ma'am, I remember from the points you had written in the comments, the vacutainer question. And when I saw the recall, I was like, oh, this was on the top of what you had mentioned.
Molluscum also, I told, I posted
Yes,
this video that it'll come. And so jinx sometimes works. And then there was CML, which was very stat. But the only thing is कि उन्होंने कुछ mention नहीं किया basophilia वगैरह. They had just given you that a massive spleen है, patient में immature cells है. So there was a doubt. And then fibroadenoma was a stat question. Everybody was able to answer. SNP, this is injustice, I'll say. This question came as a single nucleotide polymorphism. Remember the simple one, single nucleotide polymorphism ना एक girlfriend की तरह होता है. ये हमेशा disease mutation के साथ जाता है. So they are co-inherited with the disease mutation. So that was the correct option in that. Chronic granulomatous disease में there was a given test, dihydrorhodamine, which we have discussed so many times. Dihydrorhodamine आए, आंखें बंद करो, CGD mark करो, खत्म काम. Ulcer margins, just now they have discussed. So it was basal cell carcinoma. Dr. Pallavi discussed just now. So it was asked to you, and rolled margins. Netosis was another tricky question which was there with you. Remember, it was which is not correct option. That was the question that was given to you. So it was very simple. Netosis के साथ autoimmune disease हो जाती है. So SLE was in the option, and it helps in inflammation, and it also helps in trapping the microbes. Platelet वाली option जो थी वो गलत थी. That was wrong. Radiosensitive stage G2M होता है. Iron deficiency also was my jinx question I had posted. TIBC increased होता है. That we have already talked. NF1 already Shivani ma'am discussed, optic nerve glioma. Infective endocarditis culture, just now Rahul Rajiv sir also said, this was your INICT question which came this time. So basically either you take 3 culture sets or you take 2 culture sets with 2 aerobic and 1 anaerobic, or you take 3 culture sets with 1 aerobic and 1 anaerobic. So you have to just check what option was there. And then there is a Philadelphia chromosome, which is reciprocal translocation. It is balanced reciprocal translocation. And Levy body was an image-based question which was given. Okay. Now the what is the controversial question here? That also we should discuss. CML is the controversial question here. As Dr. Sophia is also saying, age 20 years दी गई हुई थी. History में immature cells दिया हुआ है, massive spleen दिया हुआ है, but age was given 20 years, isn't it? So the students were confused between AML or CML. So I was always that's what I was asking students, कुछ और जरूर होगा क्या? ब्लीडिंग मैनिफेस्टेशन दिया हुआ है, ब्लीडिंग गम्स दिया हुआ है, थ्रोम्बोसाइटोसिस दिया हुआ है. यू हैव टू सर्च फॉर द एडिशनल ऑप्शंस, क्योंकि अगर 20 ईयर है तो CML comes down in the list. Okay, so it comes down, so एक AML आ जाता है, लेकिन massive spleen AML में usually नहीं होता है. So there is some controversy in this question, so I would like to have a better recall of this question. Obviously it's so that is why I say this question is a controversial question. The rest of the questions I think they were okay. One more question which somebody messaged me just now, cholesterol accumulation किसमें होती है? So you all know xanthoma and all those conditions which we have studied, इसमें foam cells होते हैं, all those have cholesterol accumulation. So Sophia, you are right with this. 20-year-old में there is a controversy on this, but massive spleen AML में I have not seen till now. अगर massive spleen दिया है so we should go for CML. And I have seen 20 years old patient with CML. But agar massive spleen hai, to answer should be CML. Then you don't have to think of anything else. That is the only thing I will say. So that is about the recall I would like to say, sir. That's it. If you want, if anything you want to ask students, you can ask. If you have any doubts anywhere, you can always ask.
Ma'am, this is what I had told the students in my classes as well as the revision lectures. Make sure that you see the INI-CT and the NEET PG question papers of that year. They have a habit of repeating the questions in the INI-CT and the FMGE exam. You know, INI-CT happens in November, and then the December or the January exam, there are some questions from there. So this is what happened across a lot of subjects this time also. So all the students who are watching, for an extra edge to your preparation, if that may give you a few extra correct questions, please make sure, for all the ones who are yet to give the exam, who are also watching this, see the, other papers also. Just see the papers. That's it. Don't read the explanations. Just the questions.
And Abhijit is saying that the spleen that was given was still umbilicus. So umbilicus tak spleen aa raha hai, so that is a massive spleen only. Usually AMLs do not have that. So that is why I would go for more of CML as an answer to this question. Okay?
Thank you so much, ma'am. And moving forward, we have, I think I'll discuss a few things with radiology. And before we wind up the session, please add up whatever extra questions you feel we have missed out in the comment section in the same video. And please, stay tuned. We'll be releasing the subject-wise recall questions on the DocTutorials app with the proper framed questions with the options. And as far as radiology was concerned, radiology also, this exam has been very, very standard paper for radiology. We had one question in radiotherapy. We had the question on radiosensitive and radioresistant cell phases, right? So the radioresistant is the latest phase and the radiosensitive is the G2M checkpoint. We had a image on CT scan image on SDH, right? On a right SDH was given. They had given a radiograph of the femur pinpointing on the lesser trochanter, asking which muscle was inserted. That is the iliopsoas muscle. Cannonball metastasis, the pulmonary metastasis, secondaries to the lung, the chest radiograph was there. There was an image asking you the bulbar urethra, the location of the bulbar urethra on the RGU and the MCU images. They asked you what is the radioisotope that is used in PET scan, that is 18FDG. And they had asked Holman-Miller sign or the antral sign with juvenile nasopharyngeal angiofibroma, that is the anterior bowing of posterior wall of maxillary sinus. And they were also given a clinical scenario and the patient developing DVT and what is the investigation that you would like to do. That is a Doppler ultrasound or a duplex ultrasound. And these were some important questions. There was also a question on atelectasis of the lung. We'll come up with the proper images and the recalls for going forward. So pretty much I feel this has been a moderate paper. Stay hopeful for the upcoming results also, and we are all sure that you all will come out with flying colors. And after a exhaustive 6 months of preparation, you deserve a break. You deserve to connect back to your family, to your friends, take take out time, stay relaxed, and enjoy this phase. This phase will be, even when you clear your exam and join your internship, this is going to be a more hectic phase coming up. So this is a very crucial phase. Please take out time and rejuvenate, and we'll come back with a lot of success stories, and we would want to hear from each one of you. The entire doctoral team has put in a lot of effort for you all. We would want to hear your success, so do come back and share us once you get your results. We'll be happy to take you up in the sessions. Also, we'll have a lot of interview sessions with all faculty team also, so please do write into us once the results come out also. So all the best from our team for your results, and thank you so much for everybody, like for the entire doctorals team also, for joining so late and on this day. And thank you, and I hope this session was useful for all the students to just see the topics that were coming. The topics had remained the same. The previous year topics that all the faculty stress on, the topics have remained the same. Very few new questions, but most of the exam is done by your previous year topics. So stay focused on those topics, learn the topics well, don't just by heart them, understand the concept, relevant concept. And for all the future aspirants, this should be if you stick onto your previous year topics, you would have a good exam going forward. Thank you so much, everybody, and thank you so much, sir, Rohit sir, Rahul sir, and Pallavi ma'am. Thank you so much, and we'll all come back with a proper framed recall soon. And thank you so much.
Everyone. Thank you, everyone.
Thank you, sir. All of you enjoy.
Thank you,
Bye-bye.
everyone, and all the very best. And we are praying for you for
in
your
the
good
comment
results.
section, you can type in the detailed version of the question, because that would actually help us come up with a quick detailed recall as well. So if you're watching the session late, in the comment section, please just type in the exact framing of the question. Thank you so much.
Thank you so much, everybody.
Thank you.